Okay, hello. So today's topic is esophagus. What is esophagus? Esophagus is a tubular structure that is 10 inches in length. This is about approximately 10 inches in length or 25 centimeters. It is continuous above with the pharynx, the laryngopharynx, the laryngeal part of pharynx, that is the third part of larynx. The first two being the nasopharynx and the oropharynx. Third part of pharynx, that is the laryngopharynx, continues downwards as the esophagus. This fleshy colored tube is the esophagus. So it starts at the level of sixth cervical vertebra, that is the lower extent of the pharynx, and then it passes through the diaphragm at the level of the 10th thoracic vertebra, which is the esophageal opening of the diaphragm, that is at the level of the 10th thoracic vertebra. Here in this picture, we can very well see the relations of esophagus. This tube is the esophagus, this posterior-most tube is esophagus. Anterior to this tube, we can see the trachea, this white-colored cartilaginous structure is the trachea. And anterior to the trachea, we can see the arch of aorta. This arch of aorta is converted into the descending aorta on the left side of the esophagus. What else we can see on the left side of the esophagus? We can see the left subclavian vein and the left subclavian artery. In addition to that, on the left side of esophagus, we can see the thoracic duct, this left bronchus. Okay, what can we see on the right side of the esophagus? Here we have, in this picture it's not visible, but we have the arch of aorta. In addition, we have the azygous vein that is entering into the superior vena cava. Anterior to the esophagus, we can see trachea. And what else? The heart and the pericardium, that they also lie anteriorly. In addition to that, we have the recurrent laryngeal nerve. Posterior to the esophagus, obviously, we'll have the thoracic vertebrae, the thoracic duct. As the thoracic duct moves from the right side posteriorly towards and comes to lie on the left side. So it is initially on the right side, then posteriorly, and then finally on the left side. So relations, as I've told you before, we'll just recall. Anteriorly, we can see the trachea, the left recurrent laryngeal nerve, the principal bronchus, and the pericardium covering the heart. Posteriorly, we'll see the thoracic vertebrae, thoracic duct, esophagus vein ka part, and in addition, right posterior intercostal arteries and descending aorta. On the right side, we'll see mediastinal pleura and the terminal part of esophagus vein. Left side, we'll see the left subclavian artery, the aortic arch, thoracic duct, and the mediastinal pleura. Inferiorly, we'll see the vagus, the two vagi. The left vagus will be anteriorly and the right vagus will be posteriorly. And the opening of the diaphragm, from where it passes, it enters into the abdominal cavity, the esophagus. It is accompanied by the two vagi, the left vagus and the right vagus. In addition, it is accompanied by the branches of the gastric blood vessels and lymphatics. The blood supply of esophagus is very interesting. The upper part, will divide it into three parts: the upper part, the middle part, and the lower part. So the upper part is supplied by branches of the inferior thyroid artery. The middle part is supplied by branches of the descending thoracic aorta here, and the lower part is supplied by branches of the left gastric artery. The venous drainage is likewise: the upper part is drained by inferior thyroid veins, the middle part is drained by the azygous vein, and the inferior part is drained by the left gastric veins. The lymphatic drainage is very easy, it's very simple. The upper part drains into the deep cervical lymph nodes, the middle part drains into the superior posterior mediastinal nodes, and the lower third drains into the left gastric nodes and eventually into the celiac nodes. Nerve supply is both sympathetic and parasympathetic, and it is through the vagi and the sympathetic trunks. The most important thing about esophagus are the three esophageal constrictions. The level of these constrictions is important. The first constriction is at the level of C6. It is the point where the pharynx becomes the esophagus. It lies at the level of C6 vertebra. The second constriction is at the level where the arch of aorta crosses the left bronchus. It is at the level of T4 thoracic vertebra. And the third constriction is at the level where the esophagus enters into the crosses the diaphragm and enters into the abdomen. So this point is at the level of T11 thoracic vertebra. And for surgeons, the this distance of these constrictions from the incisors is very important. From incisors, the first constriction is at 14 centimeters away, the second constriction is 24 centimeters away, and the third constriction is 38 centimeters away. Next important clinical for esophagus is the portosystemic anastomosis. So what is portosystemic anastomosis? What happens is that at the lower third of esophagus, the azygous veins, which are the systemic veins, anastomose with the left gastric veins, which are the portal veins. So in case there is portal hypertension, there will be formation of esophageal varices, and varices are dilatations of veins which is weak structure, and they can rupture, leading to hematemesis, which is vomiting of blood, and this is fatal. That's all for today. If you have any queries, please ask.